Making lives work.
Making lives work.
All right. Here it is.
Together we make lives work.
Making lives work.
A care circle is a crucial part of stroke recovery because no one can really battle this alone. I mean, we have a few folks that have to battle this alone and it's very difficult for them. But when you're going through something that's just turned the apple cart of your world upside down, you need friends, family, loved ones, physicians, therapists, nurses, and psychologists. It takes a village, really, to help this process along, because if you try to do it in isolation, the chances that you're going to have a great outcome, I think, are diminished.
Oh, my family was just tremendous.
On the count of three. One, two, three.
Oh, shoot!
My brother helped out early on with finances. I couldn't even figure out how to open up my cell phone and use my cell phone at first when I was in the hospital.
We were a close enough family that we could work together, and Hans really basically, I think, took care of the financial part of it. And Sarah, with her medical background, I mean, it was wonderful that she could maybe ask the questions that needed to be asked that maybe we couldn't think of.
One of the first few days, Bill's friend she knew how to set up a Caring Bridge site. So we set up the Caring Bridge site. Caring Bridge is a wonderful resource or a tool for families so that not everyone is calling us and asking, how is he doing? They could read the Caring Bridge. And
having that support from multiple arenas, whether it's spiritual, emotional, practical, run to the grocery store, make some meals, do some laundry. All of these things are really helpful. And if there are other people in the care circle that can take something off the plate of the main care provider, then that gives them more energy to dedicate to the stroke survivor.
when he came home and he had to get into United for therapy, that was a lot to put on Mom and Dad to be driving him back and forth every day. So we set up, and we think it was called Helping Hands, a calendar that we could send the link on our Facebook, and then people could sign up to give him rides, and they'd come to Mom and Dad's house, pick him up, bring him in, do whatever they wanted to for a couple hours, and then bring him back home. And we ended up with more volunteers than we needed.
I remember the rides, when people would sign up for rides, and it would be amazing people. I'm like, I don't have a clue who these people are. I mean, obviously they're Bill's connections, but I mean, people would just kind of come in from wherever and help out, and that's huge.
We had a tough time to drive him in because everybody in town, it seemed like, volunteered to drive him over for his program.
Reaching out to others, letting people be supportive, and letting people help and do things that they want to offer to help, because it's part of rebuilding that bridge, it's part of rebuilding that community. The Care Circle, in a big way, are cheerleaders for that stroke survivor, even if it's something small. Dad, you couldn't do that last week. You know, Mom, you've had such a breakthrough with what you learned to do in the last few days.
Patience. Be patient with them and let them try to do what they can do. Don't do it for them.
Definitely.
When he wanted to do something, he did it. When I would take him to the store, no, I can do this myself, back off. He wanted to be independent again, and I needed to support him in that and let him be a man and not my little brother.
And to always have hope and encourage them, and not pity by any means.
No pity. And encourage each other in the circle. Help each other through this.
Just hang in there together and work together as a team. The better you can support each other, it's the better for everyone involved.
We offer a lecture series, which is the Courage Kenny Graduate School, which consists of 6 lectures every year at various locations, which can be very helpful to caregivers. We also have support groups. Sometimes folks come together with survivors and caregivers, and sometimes we separate out caregivers and survivors and have some personal private time. We also have something called the Peer Visitor Program, which consists of people who have already had a stroke in the past, who have been specially trained to come and mentor those who recently had a stroke.
We had started this, Bill had the stroke on the 14th, right? So we started it the next day and we just wrote notes to each, like if I was there in the morning when the neurologist stopped in, I'd write down what he said so that if Sarah came in later in the day, she could see, oh, the neurologist was already here, or Bill was really sleepy this morning. It was nice for us to be able to walk in and say, okay, what was he doing this morning? Did he eat? Did he, what doctor stopped in? So.
Many caregivers actually come back and say that even though the stroke was a difficult experience to go through, that it has brought them closer together with the stroke survivor. That going through this difficult experience, triumphing over the adversity, has brought many people closer together, has made some folks more patient, more caring, more kind than perhaps they ever thought that they could be. So it can be a growing experience for people as well.
It brought us to much closer as a family, and that, well, if this part of the whatever we needed to do was too heavy for Mom, I would pick it up, or Sarah could, or Hans was better with the finances, so he took that, and we all played on our strengths.
It brought us closer. We were here to help one another. It just makes you grateful for family, for friends.
Bill was the drive in this, but I don't know if the prognosis would have been as good without a care circle there to help him through it. I'm not trying to look like pat myself on the back, but I mean, we all jumped in together and became this circle that helped him through it.
So many people helped me out. And I'll say it again, I'm one of the luckiest guys alive.